The most dangerous time to take blood pressure medication. There comes a time each day when a simple pill can quietly turn from helpful to harmful, and most people over 50 don't even realize it's happening. Blood pressure medicine saves lives, but taking it at the wrong time can lead to dizziness, dangerous falls, heart strain, or even silent damage over time. Many seniors follow the same routine for years without knowing that timing matters just as much as the medicine itself. This isn't about fear, it's about awareness. Because one small change in timing could protect your heart, your brain, and your independence for years to come. If you or someone you love takes blood pressure medication, this could be life-changing information. Take a moment to like this video, subscribe to the channel, and share it with family members. A simple habit adjustment could prevent serious health risks and help someone live safer, longer, and stronger. Taking blood pressure medication right before bed may seem convenient, but for many seniors it can cause blood pressure to drop too low during sleep. During the night, the body naturally lowers blood pressure as part of its resting cycle. When medication is taken at this time, the combined effect may lead to excessive drops, especially in older adults whose regulation systems are more sensitive. Some doctors warn that this nighttime dip can become risky when a person wakes up suddenly to use the bathroom or adjust position. A rapid change from lying down to standing may trigger dizziness, lightheadedness, or even brief loss of balance. Research on aging populations has shown that nighttime hypotension is linked to a higher risk of falls, which can lead to serious injuries and longer recovery times. Certain medications, particularly those that act quickly or strongly relax blood vessels, may increase this effect if taken too late in the evening. This does not mean nighttime dosing is unsafe for everyone, but it does require careful consideration. Doctors often evaluate factors such as kidney function, heart health, and sleep patterns before recommending the ideal timing. Paying attention to symptoms like morning weakness, nighttime dizziness, or unsteady movement can provide important clues. Proper timing should always be discussed with a healthcare professional, ensuring that the benefits of treatment are achieved without increasing unnecessary risks. In some cases, adjusting the schedule by hours can help maintain stable blood pressure levels while reducing nighttime complications and discomfort overall. Taking medication on an empty stomach early in the morning can cause sudden drops in blood pressure. After several hours of fasting during sleep, the body may already be slightly dehydrated, and blood pressure levels can be lower than usual. When medication is introduced without any food, its absorption may happen more quickly, leading to a stronger and faster effect than expected. Some doctors warn that this rapid drop can result in weakness, lightheadedness, or a faint feeling shortly after standing or moving around. For seniors, this effect can be more noticeable because metabolism tends to slow with age, and the body may take longer to stabilize blood pressure changes. Research involving older adults suggests that early morning hypotension is a common contributor to falls, especially during routine activities like getting out of bed or walking to another room. Certain blood pressure medications are designed to relax blood vessels or remove excess fluid, and without food in the system, these effects may feel more intense. This does not mean that morning dosing is always unsafe, but timing and conditions play an important role. Doctors often recommend evaluating how the body responds, especially during the first hours after waking. Symptoms such as sudden fatigue, blurred vision, or unsteadiness can be signs that the timing may need adjustment. Taking medication with or after a light meal may help create a more gradual effect, allowing the body to adapt more comfortably. Proper guidance from a healthcare professional ensures safer blood pressure control and reduces unnecessary risks. Taking blood pressure medication right after a heavy meal can affect how the body manages circulation and energy. After eating a large meal, blood flow naturally shifts toward the digestive system to help break down food and absorb nutrients. This process can already cause a mild drop in blood pressure, especially in older adults whose cardiovascular responses may be less adaptable. Some doctors explain that when medication is taken during this period, it may amplify the natural post-meal drop, leading to increased fatigue, dizziness, or a sense of heaviness. Research on postprandial hypotension, a condition where blood pressure falls after eating, shows that it is more common in seniors and can contribute to balance issues. This effect may become more noticeable when standing up or walking shortly after a meal. When the body is still focused on digestion, certain blood pressure medications work by relaxing blood vessels or reducing fluid levels, and their impact may feel stronger when combined with the body's digestive response. This can create a temporary imbalance in circulation, making it harder to maintain steady blood pressure levels. For older adults with sensitive cardiovascular systems, this combination may increase the likelihood of weakness or unsteady movement. Symptoms such as drowsiness, lightheadedness, or reduced alertness after meals may indicate that timing needs attention. Doctors often suggest observing how the body reacts during this period and adjusting medication timing if needed. Allowing the body to complete initial digestion before taking medication can help maintain better balance and reduce discomfort or sudden drops in blood pressure. Taking blood pressure medication during dehydration can place the body under significant strain and lead to dangerously low blood pressure levels. When the body lacks adequate fluids, blood volume decreases, making it harder for the heart to circulate blood effectively. In this state, the natural pressure within the vessels is already reduced, and introducing medication can intensify this effect beyond safe limits. Some doctors warn that dehydration combined with blood pressure medication may result in symptoms such as extreme weakness, dizziness, confusion, or even fainting. This risk becomes more serious in older adults, as aging reduces the body's ability to conserve fluids and respond quickly to sudden changes in circulation. Research shows that seniors are more vulnerable to fluid imbalances, particularly during hot weather, when sweating increases fluid loss, or during illness involving fever, vomiting, or diarrhea. Certain medications, especially those that remove excess fluid from the body or relax blood vessels, can further lower blood pressure when hydration levels are already low. This combination may lead to a sharp drop in circulation, reducing oxygen supply to vital organs. As a result, simple movements like standing or walking can become difficult and unsafe. Warning signs such as dry mouth, dark urine, fatigue, or unsteady balance may indicate dehydration is affecting the body. In such conditions, doctors often advise extra caution with medication timing, ensuring proper hydration and monitoring symptoms closely can help prevent sudden complications and support more stable blood pressure control during vulnerable periods. Taking blood pressure medication right before physical activity or even light walking can cause blood pressure to drop too quickly. During movement, the body naturally adjusts circulation to supply muscles with oxygen and maintain balance. When medication is introduced just before this process begins, the combined effect may lead to a faster and more pronounced decrease in blood pressure than expected. Some doctors explain that this sudden drop can interfere with the body's ability to stabilize itself during motion. As a result, symptoms such as dizziness, lightheadedness, or a feeling of unsteadiness may appear within minutes of starting activity. Research involving older adults has shown that blood pressure fluctuations during movement are closely linked to balance control, and any disruption can increase the likelihood of falls. Certain medications that relax blood vessels or reduce fluid levels may intensify this response, especially when the body is already preparing for physical exertion. For seniors, even mild dizziness can quickly turn into a dangerous situation, as reflexes and coordination may not respond as quickly as they once did. This makes timing especially important when planning daily routines that involve walking or exercise. Warning signs such as blurred vision, sudden weakness, or a loss of steady footing during activity should not be ignored. Doctors often recommend allowing enough time between taking medication and engaging in movement, so the body can adjust gradually. Careful timing can help maintain stable blood pressure, reduce discomfort, and support safer, more confident physical activity without unnecessary risk. Taking blood pressure medication when dizziness or weakness is already present can further lower blood pressure and worsen the condition. These symptoms may already signal that circulation is unstable, and adding medication at that moment can push levels below a safe range. For older adults, this drop may happen quickly and with stronger effects due to age-related changes in how the body regulates blood flow. Some doctors warn that taking medication during an episode of dizziness can increase the risk of fainting or sudden loss of balance. Research on blood pressure management in seniors shows that pre-existing lightheadedness is often linked to temporary drops in circulation, and additional medication may intensify that drop. This can make simple actions like standing, walking, or even sitting upright feel difficult and unsafe. Certain medications that relax blood vessels or reduce fluid volume can amplify these symptoms when the body is already struggling to maintain stable pressure. As a result, the brain may receive less oxygen for a brief period, leading to blurred vision, confusion, or a feeling of near fainting. For seniors, even a short episode of instability can lead to falls or injuries that take longer to recover from. Warning signs such as persistent weakness, spinning sensation, or unsteady posture should be taken seriously. Doctors often advise pausing medication temporarily in such situations until proper guidance is given. Monitoring symptoms and seeking medical advice can help prevent complications and ensure that treatment supports safety rather than increasing unnecessary risks. Combining blood pressure medication with other medicines at the wrong time can intensify its effects and lead to unsafe drops in blood pressure. Many medications influence how the body controls circulation, fluid balance, and heart function, and when taken too closely together, their effects may overlap. For seniors who often manage multiple prescriptions, this interaction can become more pronounced and difficult to predict. Some doctors warn that certain combinations, such as blood pressure drugs taken alongside diuretics, sedatives, or medications for heart conditions, may amplify blood pressure-lowering effects if not properly timed. Research on polypharmacy in older adults shows that overlapping medication schedules can increase the risk of hypotension, dizziness, and balance problems. These effects may not appear immediately but can develop as medications reach peak levels in the bloodstream at the same time. The body's ability to process and clear medications tends to slow with age, which means drugs may remain active longer and interact more strongly. This can create periods where blood pressure drops too low, especially during routine activities like standing, walking, or changing position. Even mild symptoms such as fatigue or lightheadedness can signal that medications are affecting the body more than intended. Doctors often emphasize the importance of spacing medications correctly to avoid these overlaps. Paying attention to timing instructions and noticing any unusual symptoms can help prevent complications. Coordinating medication schedules carefully supports more stable blood pressure control and reduces the risk of harmful interactions that could impact daily safety and overall well-being in seniors. Following a consistent, doctor-recommended schedule is the safest way to take blood pressure medication and maintain stable control. Blood pressure naturally changes throughout the day, and medications are often prescribed to match these patterns. Taking them at the same time each day helps create a steady effect, avoiding sudden spikes or drops that can strain the body. Some doctors explain that consistency allows the medication to build a predictable rhythm in the bloodstream, supporting smoother regulation of circulation. Research in hypertension management shows that patients who follow fixed dosing schedules experience fewer fluctuations and better long-term outcomes. For seniors, this stability is especially important, as the body may take longer to adjust to changes in medication levels. Personalized timing is a key part of this approach. Doctors often consider factors such as daily routine, sleep patterns, kidney function, and the use of other medications before recommending the best schedule. For example, certain medicines may be more effective in the morning, while others may be suited for evening use. Depending on how they interact with the body's natural cycles, changes in timing without guidance can lead to inconsistent results, including periods of low or high blood pressure. Staying consistent helps reduce symptoms like dizziness, fatigue, or unsteady movement. Paying attention to how the body responds and maintaining regular communication with a healthcare provider supports safer and more effective treatment. A well-planned routine ensures that blood pressure remains controlled while minimizing unnecessary risks and supporting overall health. Thank you for spending these few minutes here. Growing older does not mean giving up strength and comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.